Hello and welcome to a brand new episode of COVID 360. I'm Sneha Mordani. On the show today, we tell you all about Omicron, the fifth variant of concern that continues to spread across countries. As we speak, over 80 countries have reported cases of the variant. Seen right now is mild, but the WHO says do not be mistaken as things could change. Do not dismiss it as mild in India. Cases of Omicron have increased. On the show, we tell you about what India is doing to reduce transmissions, prepare itself. What about the additional protection via the third dose, and where are the vaccines for kids? That's the question we're asking. First up, in the middle of all this, have we forgotten that we still need to do the basics? Mask up, follow COVID protocol, ventilate and ensure social distancing. Take a look at this report.
Delhi government civil defence volunteers are out on Delhi's roads, making sure Delhiites are keeping their mask firmly up their nose. An occasional fine, a brief argument with violators, a nudge to pay up for not wearing a mask, handing out a mask to them. That's what they do day in and day out. The volunteers say there's no fear of the virus in the capital. This has been the norm for months now. But is this way of enforcing COVID-appropriate behavior really going to help? When not being watched, Indians seem to hate the mask and violate social distancing norms with aplomb.
फेस मास्क आपने नहीं सर पहना? कोई नहीं, बता दीजिए.
I'm extremely sorry, and I am wearing it now. Sorry.
Why are you not wearing a face mask, sir?
I'm not wearing the face mask because I just taken it off.
You just took it off. भैया मास्क के बिना क्यों घूम रहे हो?
नहीं मास्क हमेशा लगा के रखते हैं मैडम, गिर गया रास्ते में.
In the wake of Omicron, the highly transmissible variant of COVID-19 entering India, the government has reinforced its messaging on mask usage. But the reality on ground is dismal.
हमने सबने मास्क पहनना, खूब पहनना, हम डर गए. हमने ये आदत अपनी ठीक रखी, लेकिन अब जरा उस तरफ अगर आते हैं हम, अगस्त हो गया, गिरना शुरू हो गया, सितंबर आ गया, अक्टूबर, नवंबर और दिसंबर, हम लगभग उसी पोजीशन पे आज पहुंच गए हैं जैसे कि ये जो सर्ज आई थी हमारी.
This is how grim the situation is. Indians simply don't want to mask up. The usage stands at where we were just before the peak of the second wave in India. The use of masks peaked over 80% between May and June this year, around the same time that India's devastating second COVID wave wreaked havoc. We're now back to square one.
Medical experts and the government say that the facial mask, is a universal vaccine against COVID-19, no matter which variant. Cluster outbreaks are right now being reported in the country. The message is loud and clear that we have really no other option than to go back to the basics once again.
Leave alone masks, crowds at marriage parties, get together at homes, in pubs, with all norms getting violated again, are almost back to pre-pandemic levels. Which begs the question, why are we not using the weapons we have against the infection to keep us safe, knowing very well that vaccine efficacy has been reduced against Omicron? With Sneha Mordani, Bureau Report, India Today.
Let's get you the details of Omicron cases being reported in India. Right now, Maharashtra is reporting 32 cases. Rajasthan has 17 cases. Gujarat has 5 cases. Karnataka at 8. Telangana also 8 cases. Delhi, national capital, reporting 20 cases and counting. Kerala has 5 cases. Punjab has 1. Andhra Pradesh also has 1. And West Bengal 2 has 1 case. Well, there are districts of concern in the country right now. There are areas where the positivity rate is hovering around the 5 to 10% and above the 10% rate as well. The state is Mizoram. The districts are right in front of you right now, with the positivity rates essentially are ranging from 16% to even 22%. Look at these areas. Some of them have a positivity rate of around 21% as well. Kerala too has such districts. Kozhikode, Thiruvananthapuram have positivity rates above 10%. Sikkim has these districts as well, where the Sikkim South district has a positivity rate of 25.78%. What about the R value in the country? Reproductive value, essentially, that goes on to indicate how many persons is a patient essentially infecting. States with the R value above 1, which means definitely one person, one patient is infecting one another. Delhi, Punjab, Rajasthan, Gujarat, Bihar, UP, Karnataka and Tripura are the states with the R value of above 1, and this is of concern. Now, cases of Omicron, like I said, are increasing, touching the 100th mark already. It's increasing globally as well. The super mutant has become a super spreader across over 80 countries. India is bracing for the Omicron threat. A demand for boosters and vaccines for children is growing louder. I, in fact, filed this report earlier on how long one really has to wait for the third dose or the additional dose, and also on how long you have to wait to get your children protected against the new variant. Over 80 countries and counting. Omicron variant, the fifth variant of concern, has become a super spreader. And in the light of the new threat, countries are doing what they can with the little information they have, boosting against Omicron. But not in India. There is inertia when it comes to rolling out the third dose. But the government insists it has its priorities right. Boosters can wait for the time being, is that what you're saying? Or are you saying that boosters for the immunocompromised can wait? The priority should be the second dose in India?
Correct. Yes. Yes, that's true. And for the boost, the more you protect a larger group of the population, the less there will be transmission. That's the idea of vaccinating as many, rather than take it further to a smaller group. That's the idea. And we have to know more about the disease and the vaccine and with this variant before you can actually do some recommendations around boosters.
India is deliberating on the need to administer boosters. The government on Tuesday told the Delhi High Court that expert panels are discussing this. But experts say the delay is unjustified.
We have to fully vaccinate people, and if we have enough vaccine stock, then introducing boosters is a good idea.
Meanwhile, the World Health Organization has also said that boosters at this point in time, without vaccinating the entire population, is a risk and tantamounts to hoarding.
WHO is concerned that such programs will repeat the vaccine hoarding we saw this year and exacerbate inequity. It's clear that as we move forward, boosters could play an important role, especially for those at highest risk of severe disease and death.
The government of India started its vaccination drive against COVID-19 more than 10 months ago on the 16th of January. Ever since, close to 90% of the population has got the first dose. More than 55% of the population has got the second dose. There is no shortage of vaccines unlike a few months ago. And this has what got the experts to question on the inertia of the government when it comes to both giving out the booster doses and also drafting a policy on vaccines for children. So where is the vaccine for kids?
The children carry the same viral load as adults, exactly the same viral load as adults. They are as infectious as adults and they can transmit as well as adults. Therefore, children need vaccination. It's been approved by American Pediatric Association. It's been approved by FDA. It's been approved by CDC. It's been approved by every European regulatory authority for children.
Okay.
India must have pediatric vaccination ASAP.
India has approved Zydus Cadila Zycov-D for kids above the age of 12, but the rollout is yet to happen. The vaccine will be given to adults by December, says the government, but is non-committal on when kids will get this jab. Another homemade vaccine, Covaxin has got the recommendation for a rollout, but a formal nod from the regulator is still awaited. No other country in the world is administering the COVID-19 vaccine to children as young as 2, and this is something that is weighing in on, say, government sources. The government has also suggested that there is a possibility that existing vaccines may not work in neutralizing the Omicron variant.
There is a potential scenario that our vaccines may become ineffective in emerging situations. We have to be sure about having vaccine platforms that are adaptable quickly. How soon can we create a vaccine which is using the same platform but is now targeted to the variant of the day?
A dozen questions around Omicron remain unanswered. But should India not make efforts to protect its population against an unknown enemy is the question many are asking. In New Delhi, Sneha Mordani for India Today. Well, I spoke earlier to top virologist Dr. Shahid Jameel, and here's what he said about the need to have a policy for boosters at least. He also says the country must start vaccinating children. Why is there so much inertia in India when at a time there is so much glamour? Our vaccination pace has picked up. Over 55% of people have got the second dose of the vaccine. The first dose coverage has improved as well. There is no shortage, but there seems to be a bit of an inertia when it comes to a policy decision.
Boosters are on top of 2 doses. So let's get the 2-dose number high before we start rolling out boosters. But that does not mean that we don't make a policy for boosters. Between policy and rollout, there will be a time lag. Make a policy, be very clear about how you want to do it, what vaccines you will use, what will be the priority populations, all of that. So policy needs to be made now. Boosters, the rollout can wait till we achieve higher percentage of 2 doses.
Yes.
Look at other countries. If you look at UK, where I'm currently based, UK has given 70% of its population, I'm not talking adults, population, 2 doses of vaccine. On top of that, they are giving booster doses. India has to achieve a high number with 2 doses. And there's no reason why vaccination cannot be speeded up. So we have the capacity with vaccines, we have the capacity to vaccinate. So let's get on with it.
In anticipation of increase in cases, which experts have suggested will happen in India as well, given that Omicron cases will increase in India like it has in many other countries. In this context, is it important to even further, expedite the decision-making process on giving out boosters or having a policy ready in this context?
Totally. Policy has to be expedited. You need to make a policy. But even before that, how do you give the second dose quickly to people who have received only 1 dose? And I believe one way is to reduce the difference between 2 doses of Covishield from the current 12 to 16 weeks to 8 to 12 weeks. Let's bring it down to 12 weeks from 16 weeks. We are in a situation where there is a more transmissible variant that's going to spread in India. I mean, India is not exclusive. India is just like the rest of the world.
So are vaccines working against Omicron? Vaccine makers are in a huddle, but some studies are out to suggest falling antibodies making a strong case for boosters.
It's Omicron versus vaccines. The battle has begun. But who's winning? Right now, it is the new mutant that has an upper hand. The latest study from Oxford University scientists found that Omicron is denting protection obtained after 2 doses of vaccines by Pfizer, BioNTech and AstraZeneca. In blood samples taken 28 days after second Pfizer vaccine dose, There was a 30-fold drop in neutralizing antibodies against Omicron compared with Delta strain. The impact was similar for AstraZeneca. Some vaccine recipients completely failed to stave off the virus. Moderna, meanwhile, is developing an Omicron targeting booster mRNA vaccine that could be ready for clinical testing in 60 to 90 days.
So far, available and very preliminary information suggests that vaccine effectiveness has reduced drastically against mild symptomatic infections. And a recent preliminary report from South Africa suggests that there has been a substantial decrease in vaccine effectiveness against hospitalization due to COVID-19.
As per the study, the same vaccines, when given in a third booster dose, showed 75% success in preventing symptomatic infections. This makes a fairly strong case for boosters, at least for the weak.
As far as India is concerned, we are fortunate that we have a largely young population, and vaccine effectiveness against severe disease was maintained in younger individuals, whereas declined in older individuals. It's also possible that because older individuals were vaccinated earliest, vaccine effectiveness has decreased the most for them. And this is another reason why a booster dose would be very important for them.
While we do know that COVID vaccines still save from severe disease and death, we don't know now how long we can stay protected.
We have, at this moment in India, are trying to grow the virus. Once we grow the virus, we will be able to test the efficacy of both these vaccines by taking blood from the vaccinated individuals and seeing how effective that is in the laboratory.
For COVID vaccines in India, there is still no simple answer.
The spectre of Omicron looms large over another festive month, but it's clear and the verdict on vaccines will soon be out, as they will require some tweaking because 2 doses are just not enough. India is yet to deploy a booster policy and is also in a huddle to check if the vaccines used in India will fight against the Omicron. With Ashwini Helen in New Delhi, this is Milan Sharma for India Today.
Pausing here for a break, much more news around Omicron on the other side.